There are 26 active cases of coronavirus in Victoria, with 3 new cases in hotel quarantine since yesterday. This is the 10th consecutive day where Victoria has recorded no new locally acquired cases, so the 10th 0 day, which is very pleasing. There were 14,957 tests results received today, so just under 15,000 tests that were conducted yesterday. I want to thank each and every one of those nearly 15,000 Victorians who got tested. This is so important that we keep those testing numbers up. It gives us the most complete picture. It means that we can protect those people, anyone who's found to be positive, their family, and indeed every single family, and we can stay safe and stay open. It's very simple. If you've got any symptoms whatsoever, please go and get tested, and please get tested today. You simply can't wait a day or two thinking that these things will pass. If you've got symptoms that are compatible with this virus, then given there's so little cold and flu around, you've almost certainly got this and you need to go and get tested. That needs to be the assumption that you bring to this challenge. Now, I'm very pleased today to be able to announce, and Brett is here and can speak in more broadly to his advice. I'm very pleased to be able to announce that given the public health conditions, the virus conditions in Brisbane, where the exposure site, the hotel, it's now 14 days since that was first a site where there was transmission, where the cleaner, as we all know, the cleaner was there and became infected. It is also the case now that about 90% of all the close contacts of that cleaner have been tested, and they have all tested negative. So we are now, on the advice of our public health experts, able to announce that from 6 p.m. This evening, those local government areas, Greater Brisbane, Moreton Bay, Redlands, Logan and Ipswich, will all become orange, which means from 6 p.m. tonight, people in those local government areas who have been unable to apply for a permit and travel to Melbourne or any part of Victoria will be able to apply and automatically receive a permit to travel here. It will be an orange zone under our permit system. That'll be an automatic permit. They will, however, have to isolate at home until they get a negative test, and they must go and have that test within 3 days. So they need to come home, yes, and get tested as soon after they arrive back here in Melbourne or any other part of Victoria, and once they get a negative test, they will then be free to go about their business. This is very positive news. It is all based on public health advice, and it is based fundamentally on the fact that the conditions in Brisbane have stabilised. Almost all of those close contacts have been tested. There are no positive cases, so there's been no further transmission beyond the cleaner and the cleaner's partner and the other family that, of course, was in hotel quarantine. And again, we'll leave it to Queensland to deal with those issues, but from our point of view, there is sufficient stability that we can safely have those Victorians in Brisbane return home, applying for an orange permit after 6 p.m. today, isolating and getting tested, and as soon as they get a negative test, they are then free and clear from a coronavirus point of view. They must get that test within 3 days, and I just want to inform them and all Victorians, for the purposes of confidence, we will be matching the test data and the permit data. So you can't come back and get the permit and then forget to test or not bother to get tested. It is a condition and you must go and have a test. So that's from 6 p.m. tonight. That's very positive news. And again, this is all based on public health advice. Now, in terms of Sydney, as you know, Greater Sydney is made up of a number of local government areas. We hope, based on preconditions and public health advice, with all the usual caveats, these things can change, it's dynamic, it's rapid, but we do hope that in the next couple of days we will be able to dramatically shrink the red zone, so turn a number of those local government areas orange, just as we have done with Brisbane, and people similarly would be able to apply for an automatic orange zone permit, travel back to Melbourne, get tested within those 3 days, and upon a negative result, they would be free and clear also. I wish I could make those announcements today, but we're simply not in a position. Tomorrow, for instance, will be, depending on results today and of course tomorrow, will be the 7th day of 0 local cases. There are some parts of Greater Sydney that have already reached that milestone, but the public health team just want another day or two to be able to be absolutely firm in their view that we can safely have those Victorians from, I think the majority, won't be all of Sydney, but certainly from a strong majority of those 35 local government areas. So there'll be a significant shift, that's our aim, in the next couple of days. As I said to you when I last spoke with all of you guys, I think on Wednesday or Thursday, we will get people back based on advice, always and only based on advice, and we'll do it as quick as we possibly can. So I do hope to be able to make announcements very similar to what we've just announced with Brisbane in the next couple of days. But again, it has to be based on advice. This is not a matter of locking Victorians out of their own state. It's about keeping the virus out of our state. That is so critically important. It's not about being popular. It's about doing what must be done to keep our state safe and to make sure that we can continue to rebuild, to heal the wounds of 2020, and to make sure that we can recover and guarantee that 2021 is a very different year. These are not easy decisions, and we do appreciate and understand very clearly how disruptive this has been, how challenging this has been. But when I have public health advice that says this is the way to go, I'm not about to ignore that. I'm not about to cherry pick and only follow the advice that's convenient from a political point of view. That is not leadership. That is something very different. And despite calls and commentary and criticism, that's not how we operate. We are doing what must be done to keep our state safe. And just as the permit system has proved very effective, following advice has proven very effective as well. These announcements in terms of Brisbane are based on advice. Announcements hopefully I'll be able to make in a couple of days around Sydney, again, will be based on public health advice. The very same advice, the very same data and science and doctors that saw Victorians do something that no other jurisdiction in the world has done, defeat a second wave of this virus. Now's not the time to start second guessing the experts. Now's the time to stay the course and maintain the strategy that's delivered us, all of us, delivered us something precious that needs to be safeguarded. I now might ask Brett just to add to my comments in relation to the decisions we've announced, and then we're happy to take any questions that you have.
Thank you, Premier. As the Premier said, obviously the situation in Greater Brisbane's looking very good at the moment. There's really been no community transmission beyond the cleaner and her partner. There's been extensive testing of the many close contacts of those who'd already left hotel quarantine. There was obviously the concern about transmission within the hotel quarantine system, and therefore those who'd already gone through hotel quarantine needed to have the clock set back to zero and do another 14 days of quarantine. They've been extensively tested. All of those results are negative, and many others who've been chased up as close contacts, including of staff who work in the hotel quarantine system, many of whom were regarded as close contacts, have also tested negative. So it's looking very good for Queensland, and I'm confident that we can change that designation to an orange zone. People do need to get tested within that 72-hour period, and I would also add, even if you get a negative test, if you subsequently develop symptoms of any kind, no matter how mild, you really do need to test again. 72 hours is a period of time where we want to make sure that people are getting tested to get that negative, to give us some assurance. But obviously there's 14 days from leaving that currently red zone, soon to be orange zone, that you could develop illness if you have been exposed. I think that risk is low. But anyone developing symptoms in that 14-day period, and really at any time, obviously we're saying if you've got symptoms consistent with coronavirus, the runny nose, the sore throat, the fever, the dry cough, get tested and get that negative result back to be clear that you're not a risk to anyone in your family or beyond. For Sydney, the trend is good. There are clearly some local government areas within Greater Sydney that have now got a number of days without cases, without transmission. I'll look very intensively at the epidemiology across Greater Sydney over the next couple of days, but there are obviously some hotter areas in the west of Greater Sydney, but other local government areas that have had little to no transmission in the last week or the last 2 weeks. That is looking good for some of those local government areas being under consideration for going to orange. The other thing in Sydney, and it's been reflected across regional New South Wales, is that the positive sewage detections have really corresponded to where the known cases are, either cases who have left quarantine as known cases and gone back to their place of residence, or where the known cases with the Barala cluster or the Northern Beaches cluster have been identified. So the positive sewage detections, there is nothing unexpected in those. That also gives us confidence about the local government areas that might be able to be lifted from a red zone designation. Thank you.
Very good. Happy to take any questions you have.
Premier, does this work both ways? Is it not just about returning
Yes.
Victorians, but
Yes.
also travellers?
So as an orange zone under our permit system, people will be able to travel to Brisbane, whether they, from our state, and people will be able to travel from Brisbane to Victoria, whether they're returning home to Victoria or whether they're coming here for another reason. The same rules apply though. If you're coming here from South Brisbane, say, or one of those local government areas, and you're not from Victoria, you still have to have a negative test. You still have to isolate until you get that negative test, and you have to go and have the test taken within 3 days of coming back. So it's an orange zone like every other orange zone.
What would your suggestion be to people who've got plans to travel to Brisbane? People put their travel plans on
Yes.
hold.
Look, and I look, I fully appreciate that. Just like 2020 was a year like no other, 2021 is a summer like no other, really, because things can change, and people have got to factor that into their travel plans. All we can do is provide the best and clearest advice, and we've always tried to do that to people, for people. But I can't control circumstances. This virus moves so fast, so rapidly, and we have to follow the advice and be as risk averse as we have been. We simply can't allow outbreaks. We can't do anything that would make it more likely that we finish up with community transmission, particularly some of the changes that are happening globally, where we've got this new strain that is a very significant concern to us. So I can't tell people, I can't really provide a yes or no answer to that question. All I can say is that when you're planning a trip to Queensland, or hopefully in the next few days when we make a very large part of Sydney orange rather than red, so shrink that red zone right down to a smaller number of local government areas, you just have to factor in that circumstances can change, and they can change rapidly. That's just the nature of this virus. Until we get vaccinations across the board, until we have that sort of protection, then this is going to be a feature of life in your home state and life across our nation, and indeed across the world. You've just got to factor that in. And I know that's really challenging, but I can't provide anybody with any clearer advice than that. You've just got to factor in that circumstances can change rapidly, and you might find yourself stuck away from home, and you've got to factor that into any travel plans that you're making. I can't wish this thing away, and I certainly can't start ignoring public health advice. So when you add those two things together, plus the fact that this is such a rapid and dynamic and highly contagious virus, coronavirus has got to be part of your thinking when you're making plans to travel anywhere.
Premier, the figures yesterday from Minister Foley's office were that I think it was 1,886 order exemptions that were approved from over 11,000 applications. It amounts to about 16%.
Yes.
As we look ahead to turning parts of Sydney from a red zone to an orange zone, is there any possibility of expediting some of those 11,000 exemptions?
Well, I'll just make the point. So of that number, there will be, and we can come back to you with an update, just as Martin provided you yesterday, of those in Brisbane. So anybody who is currently awaiting the processing of an exemption claim, once Brisbane goes orange at 6 p.m. tonight, they won't need an exemption. They'll simply be able to automatically apply for an orange permit and then travel back with the 3 days negative test, and there's no other requirements on them. So the ones that would need to potentially be fast-tracked, and again, there are limits to that. It's not like you can turn these things around in a day. You've got to look very closely at the individual circumstances, and that's the flip side of a very tailored system, one that is about the personal circumstances and the individual circumstances of each person who makes that claim. It means it takes time. So Brisbane, there won't need to be exemptions after 6 p.m. I hope that when I'm back before you in a couple of days' time, and I can announce that we have dramatically reduced the number of local government areas in Sydney that are red, all of those that turn orange, they won't need exemptions either. they'll then be able to automatically apply for an orange permit, get that orange permit without, there's no issue with that, and then they can travel back without the need for a exemption. There will be, so it's a long answer to a simple question, but it is a little bit more complex than it seems. The only remaining group that might then need an exemption would be those local government areas that we can't turn orange in Sydney, those that are going to remain red. And there'll be lots of different reasons why people will want to return, whether it's on compassionate grounds, all of those things. So that'll be a much smaller group, and we will work as hard as we possibly can to process those as fast as possible. But again, the challenge here is it's not a tick and flick exercise. If you want a proper appreciation of each person's individual circumstances, that does take some time. But the total cohort, the total workload will get much smaller. It already has from 6 o'clock tonight in relation to Brisbane, and it will get smaller again once we can turn a whole range of local government areas, hopefully orange from red, in a couple of days.
Do you have an idea of how many Victorians stranded in Brisbane will benefit from this decision today?
Well, it's very difficult. We've only really got the number of people who have, as Jody's question, those who have applied to get an exemption. I can come back to you and try and give you the most accurate picture of that, because it is quite dynamic, but we can try and give you those numbers.
Now that we have this traffic light system in place, you're hoping that it will give the government greater powers to warn people if they might be in an area that is likely to turn red, and give them ample time to come home so we can avoid what we saw on New Year's Eve?
Well, I don't think you can ever avoid the fact that I don't think you can ever avoid or kind of wish away the fact that this is a rapid and dynamic virus. In an instant, things can change. And I know that's incredibly challenging and difficult for people, but that's the nature of this virus. Whilst we've defeated the second wave here in Victoria, we all have to remain vigilant. We've got vaccines coming, but we haven't got them out yet. We haven't rolled them out yet. So, we may want this to be over, but sadly it isn't. So we'd always give people as much notice as we can. But the thing is, at the moment you make the judgment that an area should be declared red, and that's not a political judgment, that's a public health judgment, then you need to declare it red. So there's very rare circumstances where there's a window, if you like, where we could say, okay, you've got 2 days to get home, everybody get home. So when circumstances change rapidly, you're always going to finish up with large numbers of people wanting to get home. Some will be able to make it, whether it's at mid-afternoon through to midnight, that type of thing. You'll then see large numbers of people wanting to get tested in a very short amount of time, so there'll be queues. All of these things yes, they are inconvenient, but they are nothing compared to a third wave or having to reimpose restrictions across the city or across Metro Melbourne or across the state indeed. So that's the balancing act that we have to try, that balance that we have to try and strike, and it is not easy.
There are reports that the vaccine will start rolling out February the 15th. Can you confirm that that's the date you're going to?
No, I can't confirm that. Only the federal government are able to confirm that, I think, so I direct you to them. But what I would say is that we're working very closely with the federal government. Health ministers are working closely together. I know there's a series of meetings this week. I was speaking with Minister Foley about this yesterday. There's a series of meetings, I think, midweek, of all the health ministers and the CEOs of all the health departments. They're all getting together to see what roles, what part of this states and territories can play. We stand ready to do whatever we can to make sure that this gets rolled out as quickly and as efficiently as possible. But it's really for the federal government to confirm timing and those sorts of issues.
Premier, will you be getting the jab on camera like we've seen other state leaders do overseas?
I'll be getting the jab because that's an important part of sending a message to every single Victorian that I believe this is safe. I believe this is exactly what we need to do. Whether it's on camera, I don't know. And also priority, I think that my main priority is making sure that our health workers, our frontline workers, people who work in aged care, for instance, people who really are the greatest risk of transmitting to vulnerable people, they need to be first. That's what's happening. But if there's anything I can do to send a very clear message to the Victorian community that this is something that's so, like thousands and thousands of specialists, thousands of clinicians and clinician researchers have done little else this last 12 months but work on rolling out a safe vaccine that will be effective, and that really is our way out of this. So anything I can do to send a message that it's safe and that it's something that all Victorians should sign up to, of course I will.
Can I just ask on the... Sorry, you go ahead.
With that 72-hour window, can people get tested before they leave?
No, they need to get tested here. If they want to get a test before they leave, well, and they've got symptoms, they should absolutely get a test, and they shouldn't travel. They should isolate, and then they should wait for a negative before they get on the plane. If you had symptoms, no one who's symptomatic should be travelling back. But the key point here is the easiest thing for us to do is to have people come home from 6 o'clock. They get the permit, then they can travel. They get the test here. We will match up the permit data and the test data, so we'll know if anybody hasn't gone and had a test. That's a condition of the permit, it's a condition of the orange zone, it's a condition of entry, and it's a condition of staying safe and staying open. So we'll boost our testing capacity, but again, there'll be queues, there'll be lines, just like there is every single day. And I'll just make this point ahead of that. You never want a situation where your testing sites are anything other than absolutely methodical. It does take time. You don't want a testing site to become a super spreading site because you let infection prevention and control protocols break down. People have to be spaced, people have to be distanced. It's done in a careful way. PPE has to be changed. It is a painstaking process, and that's exactly the way you need it to be. Otherwise, you might well be spreading the virus, and that's the last thing any of us want to do.
Emirates has announced that they're cancelling the flights to Australia at the same time we've got tennis players flying in. What message do you think that sends to people overseas, and how do you assure those people that we've got our priorities right?
Well, hang on a minute. The government hasn't cancelled Emirates. Emirates have made their own decisions, and they haven't just made them in Victoria. They've made them, I think, in Sydney and in Brisbane. So they are a business. They've made their own judgments. I don't think they're citing anything other than the term they used was operational reasons. So again, I don't want people who within our caps could come home. I don't want that to be any more difficult, any more challenging than it already is. But I can't speak to what motivates a private company as to whether they fly in or out of any part of the world. And I don't think that's got anything to do with the other matters that you referenced, Michael.
What do you make of the equivalence of the opposition that other people are making between people that are stranded in Sydney and tennis players flying?
Well, I'll leave the political games and the political commentary to others. No, I'm completely unconcerned by that. It's not my focus. It never has been. It's not what's delivered us the quite precious and unique thing that we've built. Far from it. I made some comments the other day about the Australian Open. There's been a bit of commentary about, that's not accurate, that apparently the Grand Slam status of the Australian Open is chiselled in stone. No, it's not. There are literally dozens of cities around the world that would pay almost anything to have a Grand Slam at our expense. We're simply not going to do that. We are running a hotel quarantine model to the highest standard, they are the important decisions that have been made. And of course that has no impact whatsoever on the number of returning Australians that are coming into hotel quarantine here. And we'll have announcements to make fairly soon as well about increasing the number of people who can come back via our CQV process in full accordance with our agreements and the important understandings that we've reached at a national cabinet level. And we're also doing a heap of work around seasonal workers and international students. But our priority and our main focus is getting Aussies who want to come home, getting them home. And major events don't impact on that, and nor will other changes that we might make or other groups that we might make. And if you talk to people in the horticulture sector, they're pretty keen to get as many workers in as they possibly can, so they can. So we're not paying $10 for an orange. There are lots of balances here that we need to strike, and we do our best to do that.
Premier, just on that, if the contract with the Australian Open was not set in stone, does that suggest the decision to push ahead with the tournament is an economic one and not one based on market advice alone?
No. What I'm saying to you is, let's not confuse the issue. You could argue that there would always be an Australian Open tennis, whether it would be Grand Slam or not, or whether it's a pretty small regional tournament. That's what is at stake here. And to suggest that the Grand Slam status of this tournament is somehow locked in forever is simply wrong. Simply wrong. That's why John Cain, the late John Cain, built began the process of building that amazing tennis centre, because in the 80s we played the tournament at the wrong time of the year, and we played it at a venue that was not seen to be equal to a Grand Slam. It's fair to say that the Grand Slam status of the tournament in the 80s was absolutely at risk. It then became at the beginning of the year in a brand new facility, one that we have added to over time. Major events are about jobs. 2021 is all about recovery, but it's all got to be done safely. And that's exactly what we are doing. This is not an ordinary tournament. It's not an ordinary event. No events are normal. They're all COVID normal and COVID safe. So again, people are free to have their own views on these things. But just as public health advice saw us defeat a second wave, public health advice also means I can make the announcements I've just made about people from Brisbane coming back to Melbourne from 6 p.m. This evening, being able to get a permit and then travel and get tested after 3 days back, or within 3 days back, I should say. And the same public health advice will see me able, I hope very much, in the next couple of days to be able to dramatically reduce that part of Sydney that is still declared red. And that will mean hundreds and thousands of people who have been stuck in Sydney will be able to travel home on the same basis. So that's the approach that we've taken, and it's the approach we'll always take. Public health advice, everything must be safe, and that's exactly the approach that we have taken, and we won't be changing from that.
What can you tell us about that cap on international arrivals and also international students? Will you be going to National Capital on February 5 with a plan to set up that separate cap for students?
No, I saw some reporting that apparently, this is our number one priority. International education is very important. But again, there are significant limits on how many people we can bring in, whether it be seasonal workers, international students, people that are associated with an event, for instance. The notion that you can have literally tens of thousands of overseas students coming here anytime soon, I just don't think that's going to be feasible. It's just not, when you think about it. We don't have unlimited hotel capacity. When you think about the cohorts, the staff that we're using, unique. There's every single person in hotel quarantine, all the staff work exclusively for the Victorian government. There are no private contractors in there, and if cleaners, for instance, if they're not directly employed by us, then they only work for us in that CQV role. That means that there are limits, and we're not going to finish up taking 15,000, 20,000 people a week. We just could not do that. So there'll always be limits. So I'm not taking a plan on students to National Cabinet on the 5th. And reports of that are simply not right.
The government's been very clear that the influx of international players for the Oz Open hasn't impacted the number of returning Australians and Victorians from overseas.
Correct.
But some people will find it curious that today's announcement about the relaxing border with Brisbane comes a day after the outrage over the Australian Open. Was it a double standard for international tennis players versus Victorians who want to come home?
No, it's based on public health advice. And the moment that conditions in Brisbane can satisfy the Chief Health Officer to change his position and say red can become orange, that's why I'm standing here announcing it. Again, how that looks and different opinions, that's fine. People are entitled to have their opinions. I'm here dealing with the facts, the public health advice. I think this sort of grand conspiracy that it's simply beyond my control. It is 14 days since the exposure site. Our latest update is that 90%, maybe a little bit more than that, of the close contacts have been tested. That's as of today. The decision was confirmed this morning. There were discussions at meetings yesterday and the day before, and that's why I'm standing here making these announcements. There's no connection whatsoever. Yes. Well, there's some land that will be needed for stabling. That's not a park now. We have commitment in relation to a chain of parks, and we're going to try and strike a balance between both those things. If you're going to build the biggest public transport project in the country's history, then there does need to be a land for stabling. It's always very difficult to find land that doesn't see you taking houses, doesn't see you, causing all sorts of knock-on effects. We'll get that balance right. There'll still be a chain of parks. There'll still be, infinitely more parkland than there was under the commitments that we've made. But we've got to strike that balance. And if you don't have stabling, then you can't run trains. And if you don't run trains, then we're going to finish up with a second-class public transport system and a road network that simply doesn't work. So it's a difficult balance, but one that I think that we're capable of striking.
Was there any community discussion in regards to that southern stabling yard?
Well, there's been community consultation in relation to the suburban rail loop that's been going on for months and months. But ultimately, you've got to make a call, and not necessarily every call that you make is universally popular. If we waited for a universally popular way forward, then we'd be much like the government that we took over from. We would get nothing done. That's not the way we operate, and I'm not about to start seeking 100% agreement on every single thing. Otherwise, we simply would never build anything. We've got to get on. Yes, be respectful, engage with the community. We've always done that, but our job is to make decisions and get things done, and that's exactly what we've done these last 6 years, and we're going to continue doing that. This is a critically important project, and let's be clear about this. It's a project that people voted for in unprecedented terms. So we are getting on and getting this done, and I think we can strike a balance, as difficult as that can be from time to time, between our chain of parks promise and the funding that we've provided for that, and the record funding we've provided for the first stage of the suburban rail loop.
Those 3 new cases in hotel quarantine, are they tennis players or linked to their entourage?
I'd need to get CQV to confirm the exact details of those 3 cases in hotel quarantine. We can try and do that for you. If not in the show release, then later on today.
Can I ask Professor Sutton a question?
Certainly you can.
Just in terms of Sydney and the border restrictions there, what are you looking for in the next couple of days in order to ease those restrictions, / what would it take for it to scupper those plans to ease them in the next 2 days?
Look, I hope nothing scuppers the plans. Obviously, if there are no further community cases, that's going to keep everything on track. Even if there are community cases, but those individuals were known close contacts, they were already quarantining, that's something that gives me assurance that they don't represent a broader risk. If there are no new exposure sites that get published by virtue of that, that's all in the positive. Obviously, if there are new clusters that are identified in local government areas that are previously unaffected, you have to review that for what it is. Now, some of that might be concerning, some of it might not be. It really does depend how people are moving around, how many close contacts they have, where they've been, how infectious they might be, whether they transmit to others. So lots and lots of things to consider all at the same time, but the overall trend is very positive. There's been a spattering of cases in the last week, and they're largely connected to known cases.
Will it be tomorrow, you think, that you might be able to lift it? A big Sunday?
I'll go through tomorrow looking at all of the epidemiological detail across all of those LGAs and speak to Cabinet then.
The New South Wales Premier said yesterday that she wanted states to liaise more with New South Wales to get more information from them on border things. What is our communication like in New South Wales? And what is
it's a daily process. I spoke to the Chief Health Officer yesterday afternoon. I'll be in touch with the lead epidemiologist on the communicable disease side today and tomorrow. So it's a pretty intensive process. There's nothing that we would like to know that isn't forthcoming from New South Wales. So it's a very open channel.
Can I ask you, is there a radius around a quote-unquote red local government area that you would think is a buffer zone in a place like Sydney? Say if it's Berala, would it be within 15 k's of Berala?
Not a definitive buffer zone. Obviously, we need to think about the movement of people or the exposure sites for particular individuals. So even if there's a local government area that doesn't have active cases or doesn't have people who are resident there, but there are lots of exposure sites, public transport, other particular settings, we need to bear that in mind. So there might be consideration of a buffer between active local government areas, but it's not like you set a random distance and designate it as such.
What do you make of the beaches at the moment? Is that good to go from your perspective on what the federal government is?
Certainly Northern Beaches will be part of my assessments today, tomorrow. It's looking good. Again, we just need to dig down to all of the details, but it's been one of the more quiet local government areas in terms of transmission and case activity. It's not without cases in the last 14 days, but most of the activity seems to be around the Berala cluster currently.
What's your reaction to the change in WA's border restrictions, sort of touring through those back this?
Oh, obviously it's great for Victorians. You would never argue against decisions being made that favour people being able to see their family. It's terrific for them.
What do you make of the debate this week about whether we should be rolling out the AstraZeneca vaccine when there's some slight doubts that we're going to achieve herd immunity?
Look, I think Alan Cheng spoke as Deputy Chief Health Officer and co-chair of ATAGI, the Technical Advisory Group on Immunisation. Paul Kelly said very much the same thing. You have vaccines that are available in country. You want to use all of the tools available. You're not going to sit them on the shelves and not have them protect individuals. We would obviously love vaccines that can stop the risk of transmission to others to the fullest extent possible. We need to keep looking. I know the Commonwealth Government is going to continue the process of seeing what vaccines might be available. But what we have now in Australia we need to use to protect people. The AstraZeneca vaccine will absolutely do that. And so for our aged care residents, workers, others who are at the front line, we would want to use that vaccine for their protection, even if it's not at a level that might be even more protective of the risk of transmission.
Are you excited, Brett, that we could start vaccinating in next month? Is that something you...
Obviously, I think everyone, almost everyone, is delighted to see the prospect of a vaccine rollout, and our lives change. The restrictions that have been part and parcel of our lives are the things that we are all hoping fade away through 2021. That's what the prospects of a vaccine will do for a more normal life, and it's been the longest 12 months for everyone, and the prospect of a vaccine changing that is absolutely a positive that we should all embrace.
Whether it's next month or whether it's early March that people start getting vaccines, is it going to be a timeline that we can avoid another lockdown in winter, do you think, when cases seem to spread more?
You'd certainly hope that rolling out a vaccine, especially to our hotel quarantine program, the ports of entry, that if we can otherwise get on top of every bit of community transmission within the country, then the prospects of being completely free of community transmission means that we can do all of those normal things. That's what the prospect of a vaccine rollout through March, April, May can do for us. And I certainly hope that we can go into a winter with that kind of confidence of a much more normal existence.
Is it possible that people can get
Question,
two
please.
vaccines, that people can get the AstraZeneca one and then once we get more stock of, say, the Pfizer one, they then get that after?
Look, I think that's for ATAGI, the Technical Advisory Group on Vaccines, to provide advice on. The evidence from around the world is that vaccines that work in a similar way can certainly be mixed and matched, but I'm not a vaccinologist. I'm not going to be the one advising on that. But if that's a prospect that means that we can have other different vaccines add to the immunity across the population, that'll be a great thing. All right, thank you.
Can I just finish by saying, so this is obviously great news to be able to have people who've been stuck in Brisbane able to apply for a permit from 6 p.m. tonight and to travel back, to isolate till they get a negative test and to have that test taken within 3 days. There's 35 local government areas in Sydney, and we do hope in the next couple of days to be able to switch a whole range of those local government areas, the majority of them we hope, from red to orange, which means people will then be able to apply for a permit and return just as the people in Brisbane will be able to do post 6 p.m. tonight. This is all based on public health advice. That's always the way we've gone, and it's the way we will continue to stay a step ahead of this virus. Every Victorian can be proud of the part they've played, but that doesn't mean that these decisions are easy, and it doesn't mean this is over, and it doesn't mean that you can do the popular thing at the expense of doing the right thing. That is not what's built this unique and precious thing here in our state, and it's not what will safeguard it. If there's no other matters, all good. Thank you very much.